Welcome to HealthWise here on WTVI. I'm your host, Joey Pop. We're about to look at natural options to treat depression and ADHD. Dr. Speight from the Center for Wellness is here to explore triggers for depression and attention deficit hyperactivity disorder. You can submit your questions now on our Facebook page, or you can email me here on set at jpop@wtvi.org. I have my handy-dandy mobile device where I can just read these questions to Dr. Speight. And later on in the show, we're going to ask that you call us, if that's your preference, at 704-371-8895. But we have quite a few slides, and we'd like to think the first few minutes will be dedicated to an educational message. Dr. Speight, welcome back to HealthWise.
Thank you, Joe. It's great to be here.
All right, we're going to get right into the topic, and a topic like this, I'm thinking could be controversial when you're talking about ADHD, hyperactivity in kids and the treatment, and perhaps what triggers that, and what treatment options there are today.
Yeah, I would say that's definitely true. First off, we don't completely understand the entire mechanism of why ADHD occurs. Consequently, there are a number of potential options for areas of research as well as treatment. So it is still considered somewhat controversial. We do know neurotransmitters are involved, and drugs that manipulate those neurotransmitters can be helpful, and nutrients that facilitate those neurotransmitters' proper functioning can also be helpful.
In a nutshell, and I think if I can put this in layman's terms, what Dr. Speight will be exploring here with us tonight is perhaps chemicals or food additives that trigger these symptoms in young people, if in fact they do suffer with such a disorder. There could be environmental issues here. So it really should be an interesting hour, and we thank you for tuning in right here on WTVI. Let's first go right into what depression is, and what's the main depression that we're speaking of today? What's the biggest depressive episodes, if you will?
I wanted to focus primarily on major depression, which represents the majority of depression out there, probably 60% at least of all depression that people experience. And it's classified as having a major depressive episode at least one time during your life, although many people have multiple episodes. And you can see from the slide on your screen that the initial criteria include having either a depressed mood or a loss of interest or pleasure in life. But in addition to that, you need to have at least 4 or 5 of these other symptoms as well. Trouble with either weight loss or weight gain when you're not eating, intentionally trying to lose it, etc., fatigue, and a whole host of others.
What does this slide show?
This slide is designed to show the conventional treatment. The majority of people will use a medication in trying to treat depression, and so this shows the various classes of medications that are used.
So there's a lot of medications out there when you're talking about depression, and this slide similar? This
slide is designed to show that it's important that you take your medication to your physician, your medication list, and when he or she prescribes an antidepressant, it could impact some of the other medications you're on. So
it may be hard to read these, Dr. Speight, so let's just give an example. I see lithium in the far left.
Yes.
And when you come over, what does that say?
Well, it says that it can increase, if you use lithium in conjunction with a tricyclic antidepressant like Elavil, for example, it could potentially elevate the levels of lithium, and that could be toxic to the kidney. Probably the most important one on this slide, though, is anticoagulants. Those are blood thinners, and it's the second from the top on the left.
Yes.
And they increase the tendency to bleed in the presence of other when you add an antidepressant. So it's important for your physician to be aware of that.
All right, and so, and you just wanted to show that, and when you have communication with your doctor, make sure that he or she understands exactly what medications you're on.
Exactly.
All right, the next set of slides, and let's just go right to them because we have quite a few. Now we're getting right into ADHD, attention deficit hyperactivity disorder. Is this something that's just diagnosed in children, or can adults have it too?
No, 2 to 10% of the population has experienced probably ADHD. And it's a triad of impulsivity and attention and hyperactivity, and there are 3 subtypes, as you can see on the slide there. Some children have hyperactive impulsive ADHD, others are inattentive, and adults can have that as well. And there's a combination that requires having 6 components of each subtype.
Next slide. And with these subtypes, a lot of these children are put on medication.
That's
correct?
Right. That's
Is
right.
that something you're in favor of?
I think there are times when that's appropriate, and I will sometimes initiate the use of a medication with a child if it appears the situation is urgent. Most of the time, you can go through and evaluate the child first to see if there's something else you can fix, so to speak, in the way of a nutrient or environmental exposure prior to adding a medication.
This slide, in a nutshell, at least what, 6 months?
Yeah, the symptoms of hyperactivity and impulsivity need to have been present for at least 6 months to an extent that it's actually disruptive in the classroom or at home or in the workplace in the case of an adult.
As far as it being diagnosed.
As far as it being diagnosed, that's
Okay,
right.
next slide.
So in this slide, we're seeing the criteria for hyperactivity. A child fidgets, can't sit still, he's on the go as if he's driven by a motor, and talks excessively.
And I think a couple more slides shows some more symptoms.
Yes, more symptoms. These are the symptoms typically associated with impulsivity. They can't wait their turn to speak. They blurt out answers. There are issues with these symptoms beginning before age 7 and so forth. The symptoms don't generally happen with other disorders, or you can't technically call it ADHD. For example, pervasive developmental disorder, schizophrenia. These are the criteria for inattention. If they fail to give close attention to their work, they have trouble listening when they're spoken to, they don't follow through on instructions and fail to finish their schoolwork and so forth. Often they'll actually lose the things they need to complete a task, their pencil, their eraser, and because they're just inattentive.
So the next slide shows medications. Medications that are helping certain children, medications that you are speaking out against. What's the message here?
No, this is just a list of approved medications, and I'm not speaking out against them at all. In fact, what I do want to say, though, is that they should be used cautiously. The medications typically block the reuptake of norepinephrine, a neurotransmitter, and sometimes dopamine, and they can interact with other medications. They can, for example, if a child actually has bipolar, they could potentially make bipolar worse. In the case of some of these medications, the heart structure, if it's abnormal, can be affected, and you can literally have sudden cardiac death.
Okay.
So it's important to monitor a child, make sure the physician listens to the heart, that there are no obvious structural abnormalities. If there are, they need to be evaluated probably before they're put on that medication.
All right. So in a nutshell, at this point of the show, the message is if parents out there have children who are on medications, the message is make sure they're closely monitored.
Yes, make sure they're closely monitored, but also consider other options. They don't necessarily have to be on medications forever. There is some data to suggest that some of the medications actually slow the growth of children and can prevent them from growing as much as 2 centimeters or roughly an inch inside of a 3-year period. So I don't see that the medications are inappropriate, but they need to be used judiciously, is what I would say.
All right.